Assalamu alaikum. Our lecture today is salivary glands. In a human being, three pairs of major salivary glands present, which is the parotid, submandibular, and sublingual salivary gland, located outside the oral cavity, with extended duct system. Through the duct, the gland discharge their secretion into the oral cavity. So the salivary gland is called the exocrine gland because it is contain duct. And numerous smaller minor salivary glands are also present, located in various parts of the oral cavity and submucosa of the oral cavity. This picture shows the location of the major salivary gland, which is the largest one is the parotid gland, and second is submandibular gland, and this is the sublingual major salivary gland. Saliva. All the major and minor salivary glands secrete saliva. The oral cavity is kept moisture by a film of fluid called saliva that coats the teeth and the mucous membrane of the oral cavity. Saliva is a complex fluid produced by salivary gland, the most important function of which is to maintain the well-being of the mouth. The total volume of saliva secreted per day is about 1 to 1.5 liters in a human. Whole saliva. Oral fluid, which referred to as a mixed or whole saliva, include the secretion of major and minor salivary gland with desquamated oral epithelial cells, microorganism and their product, which is toxin, food debris, serum component, and inflammatory cells that can exist in the gingival sulcus. Composition of saliva. Saliva consists of 99% or more of water and 1% organic material. The organic constituents of saliva as follows: contain enzymes like amylase, esterase, histatin, peroxidase, lysosome, lactoferrin, acid phosphatase. Second, immunoglobulin like IgG and IgM. Other factors like blood clotting factor, amino acids, urea, uric acid, glucose are also present. The pH of saliva in a whole saliva is about 6.4 to 7.4 pH. Development of salivary gland. Salivary glands are a major division of epithelial tissue. Consequently, glands derived from either the ectoderm or the endoderm layer. A gland can be classified in a variety of ways based on different criteria, but all glands arise in a similar fashion. So the development of salivary gland includes the epithelium invagination into the underlying connective tissue, bringing the epithelial with basal lamina with it. The invagination develops a lumen that communicates to the original surface. The invagination differentiates into a secretory unit at its further part and a duct that connects the secretory unit to the oral epithelium. This picture shows the development of the salivary gland. This is the epithelium or parenchyma of the salivary gland, which originate from ectoderm or endoderm, and this red line represents the basement membrane or basal lamina that attach the epithelium to the underlying connective tissue. Then there is the invagination of this parenchyma or the oral epithelium toward the connective tissue and take the basement membrane with it. And this is the invagination. This forms the lumen in this invagination, and the end of this invagination we have the secretory portion or secretory acinis with, and this is formed the duct product, and in this lumen the collection of saliva occur and this discharged into the oral cavity. Histology of salivary gland. Both major and minor salivary gland composed of parenchyma, as we said, are derived from oral epithelium and consist of secretory epith or acini, either serous or mucous or combination of both, which is called serous demilion. And this secretory unit leading into duct that open into the oral cavity. The connective tissue form a capsule around the gland and extend into it. This connective tissue extend inside the gland and form connective tissue septa that dividing group of secretory unit and duct into lobes and lobules. The blood and lymph vessels and nerve that supply the gland are contained within this connective tissue capsule and connective tissue septa. Secretory acini. First, serous type. Cells of serous acini are specialized for synthesis, storage, and secretion of protein. They also synthesize polysaccharides, usually arranged as acinar secretory unit. The typical serous cell is a pyramidal in shape, so the cells of this acini is pyramidal in shape with a broad base adjacent to the connective tissue, a stroma or septa, and a narrow apex forming part of the lumen of the end piece. The spherical nuclei are located basally. The function of secretory serous cells are protein synthesis, glycosylation, which is the formation of linkage with the glycosyl group. In this, there is addition of carbohydrate side to the amino acid side chain and production of salivary amylase for digestion of starch. The serous cells contain both protein and carbohydrate, but the protein is more than the carbohydrate, so these cells appear in histological section as dark in color. The histological section of parotid gland with pure serous acini cells. This is all are the serous acini cells with pyramidal in shape cells with basally located around the nucleus and very small lumen. And this lumen is can't seen in histological pictures. And this is the duct. This is also the striated duct, and this is the pointer represent the fat cells which appear in the parotid glands, very high in number, as appear as white in color. Mucous acini, usually arranged as acinar or tubular secretory unit. They have a cuboidal or short pyramidal cells arranged around a larger lumen than the serous acini. The cuboidal cells have a thin rim of lightly stained cytoplasm, so it appears in histological section is lighter than serous acini, rich in rough endoplasmic reticulum at their base, and the flattened dark stained nucleus also present in the base of these cells. The apex is filled with large mucogenous droplet or granules whose protein have high sugar content. So in the mucous acini, the carbohydrate is larger than the protein consistency. So it appears lighter in color in histological pictures. The secretory products of most mucous cells differ from those of serous cells in important respect. First, they have little or no enzymatic activity, while the serous acini have enzymatic activity, especially in digestion of the starch as activity of amylase enzyme and another enzyme. Second, serve mainly for lubrication and protection of the oral tissue. Third, the ratio of carbohydrate to protein is greater than serous secretion, while the serous acini contain more protein than carbohydrate. Fourth, the mucous secretion contain large amount of sialic acid. This histological picture shows the mucous acini. This contain cuboidal cells or tubular cells with a basally located flat nucleus, and the lumen is larger than seen in serous acini, and this is the connective tissue stroma, where the base of these cells look like cuboidal or short pyramidal in shape and appear lighter than the serous acini because it contain droplet granules which contain large amount of carbohydrate. The difference between serous and mucous acini: in serous, thin watery secretion, while in mucus, thick viscous secretion, protein secretion, and this is mucopolysaccharide secretion. The presence of zymogen granule in cytoplasm of serous acini, while there is a mucogene droplet in the mucous acini around the nucleus, while this flat nucleus, both of them basally located. Small lumen here, while there large lumen. Indistinct cell boundary, not appear well in histological picture as we seen before, while in here distinct cell boundaries, darkly stained, and this is light stain because this contain more protein, while here is more contain carbohydrate. Enzymatic action, while this is protection and lubrication, mainly seen in parotid gland because this gland is contained purely serous acini and also present in submandibular gland. But in submandibular gland, 90% is serous acini and 10% is a mucus, while in sublingual gland is purely mucus. Mixed acini, third type of acini is mixed. Some acini units are made up of mixture of mucus and serous cells. Most often, mixed acini are composed of a mucus acini which is capped by a serous demilune. So the mixed acini is called serous demilune. That is a cap of serous cells sitting on the mucus acini, and the secretion enter the intercalated duct. This histological picture shows the serous demilune. This is the serous acini capped the mucus acini. Both of them is called mixed acini or serous demilune. And this is the serous acini with a small lumen and pyramidal shaped cells with basally located around a nucleus with dark stain, while this is the mucus acini with larger lumen and flat basally located nucleus with lighter color and histological section. Myoepithelial cells. This is not as a secretory endpiece. The function of these cells is for the contraction of acini. Also called basket cells, are contractile epithelial cells, have no secretory function. These cells are closely related to the secretory endpiece and intercalated duct cells. Its function is to support secretory unit and also may facilitate secretion by contracting and causing the ejection of performed saliva. So it is location on the acini, either serous or mucus or serous demilune, and this is look like basket cells with contractile property. Myoepithelial cells prevent the distension of endpiece when the lumen folds with saliva, and their contraction accelerate secretion of the product. This is the special histochemical stain to show the myoepithelial cells which contain actin. This is the acini, serous acini, and this is the light green color represent the myoepithelial cells which appear on the serous acini, look like a basket on it, and this when this cells is contraction, this cause the lumen of these cells to discharge their secretion toward the intercalated duct, which is also present, this myoepithelial cells also present on the intercalated duct cells. This picture shows the compound salivary gland. This is the duct. This is the smaller one, which is intercalated duct, and this is the secretory end piece, which is look like alveoli present inside the lung. This is the smaller intercalated duct, which collect the saliva from the acini, either serous or mucous or serous demilune, and secretion go to the intercalated duct, and this is collected in the striated duct, and then these go to the excretory main duct. So is the salivary gland is as compound gland. The second histological component of the salivary gland is the duct. The first or small duct present in salivary gland is intercalated duct, which is small diameter, lined by small cuboidal cells. The nucleus of these cells located in the center. Also contain myoepithelial cells are present surround these cuboidal cells of intercalated duct for secretion of saliva from the intercalated to the larger duct, which is striated duct. The intercalated duct are prominent in salivary gland, have watery secretion like parotid gland. So this is histological picture shows the parotid gland with purely serous acini. We didn't have a mucous acini, and this is the fat cells appear white in color, and this is pointer shows the intercalated duct. This is intercalated duct in longitudinal section, contain a round nucleus and centrally located, and this is a small lumen. This intercalated duct collects saliva from acini and then go to the striated duct. The second intralobular duct present in salivary gland is striated duct. It contains columnar cells with centrally located nucleus and eosinophilic cytoplasm. So this appear as red in color in H&E stain. Prominently striation. There's why it's called striated, because it contains inside the cytoplasm folding of the basement membrane toward the lumen and cause striation appear inside these cells. Important function of striated duct cells is modification of the primary saliva from intercalated duct by reabsorption and secretion of electrolyte. The histological section shows the striated or intralobular main duct present inside the lobules. This histological picture shows the serous acini, maybe parotid or submandibular gland, and this striated duct appear with large lumen and columnar shape cells with centrally located nucleus and red cytoplasm or eosinophilic cytoplasm with striation in cytoplasm because folding of the cell membrane toward the lumen has appeared as striated, so it is called striated duct. This is also represent the striated duct in longitudinal section, and this is in cross section, and purely serous acini present in parotid gland with many fat cells space here, and this is the striated duct appear with centrally located nucleus and columnar cells which surround large lumen. The third duct or larger duct is the terminal excretory duct, or called interlobular duct because it's located between the lobules, located inside the connective tissue septa between the lobules. They are larger in diameter than striated duct and have pseudostratified epithelium with columnar cells extending from the basal lamina to the ductal lumen, and small basal cells that sit on the basal lamina but do not reach the lumen. The function of excretory duct, same as the function of the striated duct, by electrolyte reabsorption and secretion, such as in striated duct. This histological picture shows this is the excretory duct with pseudostratified and columnar cells, and this is larger lumen which contains saliva, and this is surrounded by connective tissue septa which contain collagen fibers and blood vessels and fibroblasts and the main structure of connective tissue. Connective tissue septa, as any connective tissue present in the oral body, it contains cells. The main cells of connective tissue is fibroblast, also inflammatory cells, mast cells, adipose cells, extracellular matrix, glycoprotein and protoglycan, mean glycogen and protein, also contain collagen fibers, oxytocin fibers, and blood supply and nerve supply. This is the histological pictures of parotid gland, shows the connective tissue septa here between this divided the gland into lobe and lobules. This connective tissue come from the capsule surrounded this gland. So this capsule divided the gland into lobules and lobe by connective tissue septa. Inside this connective tissue septa, the excretory duct is present. This is excretory duct, also this is excretory, and this is also excretory duct with different size. While inside the lobule, the striated duct and intercalated duct is present. This is the striated duct, while intercalated duct is very small. It is smaller than the acini, so it is difficult to see inside the histological picture. Minor salivary gland. Minor salivary gland are not found within the gingiva and anterior part of the heart palate. Serous minor gland, or called von Ebner, below the sulci of the circumvallate and follate papillae of the tongue. The labial, lingual, palatal, buccal, glossopalatine, and retromolar gland, typically located in the submucosal layer, with a short duct opening directly into the mucosal surface. So the minor salivary gland is with a small duct which open inside the oral cavity, and its location in submucosal layer of oral mucosa. The minor salivary gland is mainly mucus or mixed acini. Only we see in the serous minor salivary gland present in the von Ebner gland, which is located below the circumvallate papillae. This slide shows the location of serous, mucus, and mixed. Mixed is blue in color. This is mixed or serous demilume. And this green is von Ebner gland, which is located below the circumvallate papillae, while the mucus is mainly seen in the soft and some part of the heart palate, anterolateral and posterolateral of the heart palate, and also in the lip and cheek mucosa. Major salivary gland. Parotid, submandibular, and sublingual. Parotid, so-called watery serous saliva rich in amylase proline-rich protein. The main duct is stemous duct. Submandibular, more mucinous in secretion. The main duct is Wharton's duct. Or sublingual is viscous saliva. The main duct is Bartholin, and small duct is called duct of Rivinus. Parotid gland. The larger salivary gland weight about 20 to 30 grams in weight, and produce about 30% of total saliva. It's enclosed within a well-formed connective tissue capsule with a superficial portion lying in front of the external ear and its deeper part following the retromandibular fossa. It is a pure serous gland because it contains only serous acini, but there is much fat tissue between the serous acini as we've seen before in histological pictures. The intercalated ducts are long and branching, and a pale staining striated ducts are numerous. The main duct opened on inside of the cheek, just opposite to the upper second molar tooth. The duct is called Sten's duct or Stenson duct. Submandibular gland. Greatest output of salivary gland. Its weight is smaller than parotid gland, about 12 to 15 grams, and produce about 60% of total saliva. So the main secretion from the submandibular gland. Also well encapsulated, contain capsule. This gland consists of 90% serous acini and 10% mucous acini, so it's mainly serous secretion. The mucous acini occur in small patches distributed throughout the gland. Some mucous acini may be mixed or show serous demillion. The presence of light-stained mucous acini may resemble the fat deposition in the parotid, so it appears like white in color, like the fat present inside the parotid gland. The intercalated ducts tend to be somewhat shorter than those of parotid, whereas the striated ducts are usually longer. The main duct is called Wharton's duct. Third major salivary gland is sublingual gland. It is the smallest one, and it lies between the floor of the mouth and the myelohyoid muscles. It is composed of main gland and several smaller glands. The main duct gland is Bartholin duct, open near the submandibular duct, and several smaller ducts, about 2 to 20 ducts, open along the sublingual fold, is called duct of Rivinus. It is poorly encapsulated and has a mixed acini, mainly mucus with serous demillion. Function of saliva. First, it keeps the oral tissue moist and facilitates swallowing by moisturizing and lubricating the bolus, and it facilitates speech. Second, it forms a protective coat, minimizing the risk of abrasion of mucosa, and it produces a fluid seal necessary for sucking. Third, it helps in digestion of food through the action of digestive enzymes, mainly lipase, amylase, and water. It contains antimicrobial agents like lysosome, peroxidase, and immunoglobulin, mainly IgA, and small amount of IgM and IgG, which protect the oral tissue by varying of mechanisms such as the prevention of bacterial adhesion, agglutination of microorganism, and inhibition of its multiplication and metabolism. Also, the saliva, it helps in protection of teeth from dental caries by means of both cleansing and buffering action due to bicarbonate, which resists for fall in pH when acid is produced by bacteria and cause dental caries. The pH of saliva, as we said before, varies from 6.4 to 7.4 for pH. Clinical consideration. First, xerostomia or dry mouth. It's one of the salivary gland dysfunction, can occur for many reasons due to drugs or diseases or irradiation or cancer or anything or old age. Decreased saliva can lead to difficulties in swallowing, tasting, and speaking. Second, autoimmune disease like Sjogren's syndrome, which is autoimmune disease cause dry mouth and dry eye. Third, stones or calculi present inside the duct can block the duct and cause pain and swelling. Fourth, mumps, which is a viral disease, affect parotid gland and cause pain and swelling with fever. This child with a larger parotid gland with a viral infection and call this mumps. And this X-ray or radiographical pictures of lower jaw, and this is the floor of the oral cavity, and this is the calculi or stone inside the duct of submandibular gland. That's all for this lecture. Thank you for listening and goodbye.